Okay, so I'm curious to see what these things actually look like. Can you
Yeah.
give me some concrete examples of digital tools that are being used in the field right now?
Absolutely. So one example is using chatbots or virtual assistants
Okay.
to gather family history information.
Okay.
So instead of having to fill out those long forms
Right.
or try to remember everything during a counseling session,
Right. Which can be hard,
it can be really tough.
especially if it's like, going back generations.
Yeah.
You're like, wait,
Right. Who is my...
great aunt so-and-so.
Yeah,
I
exactly.
mean, they have kids and...
Yeah, it gets complicated.
Yeah.
So instead of all that, patients can just chat with a bot
Okay.
that walks them through the whole process.
And that sounds a lot easier.
It is much easier. And you know what?
Maybe.
It can actually be more accurate, too.
Really?
Yeah, because the chatbot can ask specific questions
Okay.
and follow up to make sure they're getting all the details.
So it's not just relying on the patient's memory.
Exactly.
Okay, so let's say I've chatted with the bot.
Right.
I've given them all my family history information. What
Yeah.
happens to that data?
So that information gets stored securely in your electronic health record,
Okay.
and then the genetic counselor can access it.
Got
So they can review everything before the session
Oh.
and come prepared with, specific questions or recommendations.
So again, it's not about replacing the counselor.
Right.
It's about giving them more information to work with.
Exactly. It's about making the session more efficient and personalized.
I like that.
Yeah. And another really cool example
Yeah.
is using digital decision aids
Good.
to help patients understand their genetic testing options
Okay.
and make informed choices.
So how do those work?
Well, these decision aids can break down complex information
Okay.
in a way that's easy to understand,
Okay.
and they can use visuals, interactive exercises, personalized risk assessments.
Okay, so it's not just like reading a dense medical report.
No, it's much more engaging
Yeah.
and interactive.
I could see how that would be really helpful
Yeah,
for people who are feeling overwhelmed
absolutely.
or confused about their options.
Yeah, genetics can be a really complicated topic.
Yeah, it is.
And these decision aids can help patients feel more confident in their choices.
Okay.
They can explore different scenarios, weigh the pros and cons, really clarify what's important to them.
So it's like a guided decision-making process.
Exactly. And some decision aids even let patients connect with a genetic counselor
Oh,
directly through the platform.
oh, that's great.
So if they have questions or need extra support, they can get it right away.
So it's like having a safety net.
Exactly.
You're not just left on your own to figure it all out.
Right.
I like that a lot.
And then, of course, there's telehealth.
Oh, yeah. Telehealth has been huge,
It has been a game changer.
especially during the pandemic.
Absolutely.
But even beyond that,
Yeah.
it just makes sense for genetic counseling.
It does, because not everyone can travel to see a specialist.
Right.
And with all the advances in video conferencing and digital communication, the quality of